Thank you very much, and thank you Wei Wang and Raymond. Fascinating talk about AI and what Microsoft is doing, as well as ATD. We've been involved in it. It's a great organization, by the way. If you get a chance, do attend. We've participated with ATD the past few years, and it's a wonderful organization. So you probably wonder, you got all this alphabet soup, we used to call it, you know, ABC soup, you know, they used to have ABCs, you remember that when you were a kid? So, we have all this alphabet soup, you know, what does that mean? You know, where does the human fit in? Somebody said earlier that trainers would not be replaced, right? We as workers, as humans, don't want to be replaced, and that's what we're about. Our company and our organization and the partners we work with, we've got a lot of technology that we work with, but I also owned a training company for many years. So we did training and development. We worked with dozens of companies, literally thousands of employees. And so we believe it's very important to put the human in the equation, which is what Raymond and Wei Wang were talking about. You know, smart workers, not just adding the technology, but the human-machine interaction, human 2.0, considering humans in the equation. I'm just going to give you a little background. We've got some of the technology here that we use. This is the cave, if anyone remembers, way back when augmented virtual reality began back in Chicago many decades ago. They had something called the cave. Now we have something called the IQ, and this is an immersive device. And what we're working on now, we work with many different industries, about 6 or 8 different industries, even aviation, aerospace, Industry 4.0, manufacturing. But we really specialize on healthcare, medical, biotech, pharmaceuticals. We feel these areas are very important, especially here in Taiwan. Taiwan is undergoing a digital transformation in this digital industrial digital revolution 4.0 and transforming the healthcare here in Taiwan. And so we're working as part of that, and we decided this past year to really focus on precision healthcare, precision medicine. I'm going to talk about what that is, and we're training and we're learning. We like to say learning now instead of training fits in to this. And I'm just going to give you a little bit of my background. I do come from a healthcare background, but it was kind of in my first lifetime, I like to say. Many years ago, I started out as a hospital medical center administrator and did my master's in healthcare administration. Then I moved on to Harvard University, and I was there for 3 years, and subsequently ended up getting into startups during the dot-com boom, and I probably built about 10 startup companies. I was either the founder or one of the first members of about 10 startup companies, so entrepreneurs. Some of my co-founders and some of the people that we built companies together with are some very famous people, not like me. This is the founder or the inventor of email. This is one of my founders, one of my partners. A lot of people from Harvard, MIT, so it was a great place during the dot-com boom to build a company. Then I also went on to work for Fortune 100 companies, Fortune 500 companies, Global 1,000 companies in management. So I've kind of gone back and forth and mixed them together, and really that's what everyone needs to do now. From academia to government, to the corporate world, to being an entrepreneur. So everybody here, we all need to be this. We need to be the entrepreneurs. It's about cross-company, cross-department, cross-industry, cross-discipline, cross-cultural. And so we feel we brought all of these things together to focus on the human. So I won't talk too much about that. I've got to leave right at 4, so I'll apologize right now. But I wanted to give you a little bit of information about our company so that if you wanted to contact me later, you can. The company is USBCT, and I'm the CEO. We also are the president of the VR AR Association. This is a global association with 50 locations. We're having a Vancouver Summit, September 21st and 22nd. We're bringing a group from Taiwan. If anyone would like to join us, you're welcome to do that. We're also an investment company. We recently raised about 27 million US dollars to open a new interactive digital center here in Taiwan. And that's going to be located at the Taipei City Government DigiBlock. Is anybody familiar with the DigiBlock? III is also located there. We're going to be their neighbors. So we are, we really believe in Taiwan. We believe in Taiwanese and what was called the Asian miracle, where Taiwan became one of the top 20 economies in the world. And everyone told us it was impossible. Taiwan focuses on hardware. And, these emerging technologies, it's just a little too traditional here. And I said, well, I don't believe that, I believe, with the highest math scores, the highest engineering scores, becoming one of the top 20 economies in the world, that Taiwan will be a digital leader in AI, a digital leader in IoT, and all these areas. And so we're working to pump, money and jobs into the Taiwan economy. So that's what we do. A little background. We're now working on a genetics testing company that's part of the IOMT. So IoT is Internet of Things. IOMT, Internet of Medical Things. And we also work with IIoT, Industrial Internet of Things in Manufacturing Automation, Industry 4.0. Now we're working on genetics testing, and I'm going to talk a little bit about that. Just give you a little bit of the background. Back when the Human Genome Project began, I had the opportunity to meet a lot of these people who were involved with sequencing the human genome, including Francis Collins from National Institutes of Health. So when I was at Harvard, I had the chance to meet a lot of these people. Even Watson, I didn't meet Crick. I met James Watson, who was won the Nobel Prize for discovering the DNA double helix. And then Harold Varmus, who also won the Nobel Prize and now heads up a genome center in New York. So it's really with my healthcare background, technology background, and being involved with scientists at Harvard Medical School and some of the hospitals around Harvard, I really got interested. I'm going to show you just a video here from a futurist thinker, someone I follow. I've read all his books, watched all his videos. Ray Kurzweil. He's now an advisor to Google. And he was a child prodigy, so he's a genius. He's had a future thinking, I would say, consulting company for many years. But he's written many books on the future. What is the future going to be like? And here he talks a little bit about the Human Genome Project. So it gives you a little background of the Human Genome Project and how fast things are changing. I mean, we hear this all the time, right? Exponential growth, doubling effect, doubling growth.
It's a whole area of biotechnology. We are creating new amino acids and new proteins that didn't exist before, even new bases that are not part of the vocabulary of biology. Biology is pretty remarkable, but we certainly can't say it's optimal. It evolved actually in an era when it was not in the interest of the human species for us to live very long. So you human life expectancy was 19,000 years ago, because once you were 25, you raised your kids, they were 12, ready to start their own family, and now you're just using up the very limited food and resources at the time. So as I say, life expectancy was 19. And we were going beyond the limitations of biology, but really through a methodology of hit or miss. That's how medicine was done. Up until very recently, most of the drugs and interventions that are on the market today that are used were done that way. But the Genome Project enabled a whole new approach, which is to actually understand the software of life. And that's not just a metaphor. We have 23,000 of these software programs that run our lives. They are sequences of data, and that data, as I said, evolved millions of years ago, when life was very different. And we can now reprogram that. So we do that routinely with drugs and so on, but as I say, these were designed, not designed, they were found accidentally. Here's something that lowers blood pressure. Here's something that kills HIV. We now are beginning to understand the software of life. The Genome Project itself is a perfect example of exponentials. The amount of data we sequence doubled every year. The cost came down to half every year. Halfway through that project, 1% of the genome had been collected. Mainstream critics declared the project a failure, saying totally this was an error. 7 years, 1%. It's going to take 700 years, just like you said. My reaction at the time was, oh, we finished 1%. We're almost done, because 1% is only 7 doublings from 100%. It had been doubling every year.
Okay, I don't know, did you catch all of that? I was talking about the Human Genome Project, and Ray is always ahead of the curve, thinking about the future. I mean, that's what he does. He's able to think of the future. He's able to make predictions. About 80% of his predictions have come true. You saw him there at SU Singularity University. Many of you may know. He's the co-founder. But he said, you know, after 7 years, they finished 1% of the Human Genome Project. 7 years. So everyone said, 7 years, 1%, it's going to take you 700 years to sequence the human genome. And Ray said, did you hear me? He said, you know, 1%? Oh, we're almost finished. Yeah. He said, what? Almost finished? He said, yeah. That's only, you know, it's only 7 doublings, and we're doubling every year. It's exponential growth, the doubling effect. So what we're working on now, and Ray talked about, is we're able to now, with the sequencing of the human genome, we're able to perform genetic tests, and we're able to provide precision, or we say preventative medicine, and now we like to say healthcare. What's the difference between medicine and healthcare? Medicine, more targeted. Healthcare, more holistic, which is really fits in with East and West, or West and East. We like to say W-E, we, right? So it's this holistic approach, kind of yin and yang. So what we're working on with the doctors here in Taiwan, with medical executives, is how can we change the algorithms in the AI to incorporate the macro approach of the East here in Asia, here in Taiwan. You know, you look at the whole body, the whole health, the whole healthcare. In the West, it's more precision medicine, which is targeted. You know, so we sequence the human genome. We know certain biomarkers, and there are certain drugs that can target, but not so many right now. It may be more a lifestyle change. It can be supplements, things like that. So in the past, you know, we had this one size fits all. And in the future, when we look back, we'll say, you know, what were we thinking? You know, we just gave everybody the same thing and hoped it worked. If not, we try something else. Now we're able to perform genetic testing to where we know what biomarkers you have And this is part of an overall IOMT, is where that comes in, Internet of Medical Things. So we're able to perform this analysis with a blood test. We're able to send this to via an IoT device, Internet of Things, to a mobile device. And your doctor, your physician is able to see that. And now we're adding in augmented and virtual reality. And that's really part of the learning that we're talking about here at TALENTECH, because that's going to be a big part of it. Doctors need to learn, patients need to learn, and it's turning precision medicine into precision prevention. So what we're doing is, and I'm talking about this innovative collaboration, cross-company, cross-discipline, cross-culture, is that we're creating a knowledge network, and we're creating an ecosystem. Because you can no longer, simply just experiment and discover. So here's what we're building. It's part of, most people think of, some of these technologies and they just see the tip of the iceberg. So what we're doing is we're building a complete ecosystem, and that's where the IOMT times or plus, AI, and we're also adding, cloud, blockchain for the learning. We've got LMS, learning management systems. So this can be used in medical schools. We work with medical schools all throughout the world via our partners, and learning resource systems, all different types of databases. And now we're adding for medical PET scans, MRI, where physicians are able to wear the AR glasses, and performing surgery. They have a projected digital overlay on your head while they're doing the surgery. In the past, doctors or physicians need to be very good at physics. So they had to have a very high physics score because they need to be able to see in 3D, right? That's physicians have traditionally needed to have this ability to see in 3D. Now they really can see in 3D with MRI projected. So your MRI is projected onto your head. And so when the physician is doing the surgery, he or she can see, what's going on. And then we've added in some other technologies, gene editing. I'm going to talk a little bit about AI. We've got Google Lens. We've got Microsoft HoloLens. So we work with Microsoft and a lot of these companies. So we're really building, an ecosystem, and it requires, input and collaboration with entrepreneurs, with policymakers, even device manufacturers we're working with here in Taiwan to bring together hardware and software. So, it's a major goal of the government, major policy initiatives, and companies in Taiwan is to bring together hardware and software, and we're doing that through building this ecosystem. I'll speed up a little bit. We work with local and global partners. So what we do is we're the bridge for Taiwan. We feel we're the bridge that connects Taiwan to the world and connects the world to Taiwan. So we work with the top, we go through a due diligence process selecting the top AI companies in the world, top IoT companies, and then working with local biotech companies, local medical device manufacturers, and others. Here's Dr. Ethan Huang, and he's a great example of someone who's really a creative artist. He calls himself a doctorpreneur. So it's entrepreneur and doctor. We have intrapreneur, entrepreneur. And so really doctors, engineers, everyone now needs to be an entrepreneur. You need to be a consultant. You need to be a creative artist. You have to know technology. You have to know every area, right? You have to be a generalist and a specialist. And that's what Dr. Ethan Huang does. We also work with another company. We're a disclaimer, I'm a strategic investor. We're a strategic investor in this company called Winnows. And they've raised about $2 million working on, we've just raised another $1 million But they're doing a genetic test, and they've got a device called IOMT, and this is a blood drawing device. So it allows you to draw blood from the finger. You can obtain enough blood to perform genetic tests without the pain and danger of an IV stick in the arm. So it involves biosensors. It is an AI IOMT. It's we're working with many different medical manufacturers here in Taiwan. It includes AI. It's got a microprocessor. It's an IoT device, so it sends the results to mobile phone, and we hope, to augmented virtual reality later in the future. We're also working with one of the top AI healthcare companies. They're implementing this telemedicine, telehealth program in China with Tencent, with WeChat, and we're working with them to modify the algorithm, again, to include holistic healthcare here in the East, which will provide personalized, customized, precision healthcare, or preventative healthcare is better. We want to focus on preventative wellness and healthcare rather than curing people. And this will allow you to have a 3D diagnosis. It goes through a chatbot. Raymond was talking about using chatbot, NLP, natural language processing, so you can tell it what's wrong with you. It will give you a diagnosis. It will create a 3D digital twin. And what we're working to add is a genomic 3D digital twin, so that you know and you can learn about your genome, but also your doctor can learn. And our goal is to provide AVR, augmented virtual reality, in the patient, either in the doctor's office or set up a separate center to allow you to learn about your genetics, about your genome. What does that mean if I have a certain biomarker? What supplements can I take? What can I do to change that? So it involves the learning. It involves the coaching and learning. Now here's one of the, we go from phone to dome. So we have all different types of integrated systems. Here's one that's used at Oral Roberts University. This is a cancer doctor, and he is showing the human eye here. But what we're working on is to show the genome, where you'd be able to walk through your genes and see what biomarkers you have, and then you're together with your doctor. You can learn, what can I do? What can I change? What lifestyle can I change? What supplements can I take? What medical treatment can I have that's available to me? So this is called the iCube. It's wearing the 3D infrared glasses, so you're fully immersed in this environment. So it's really, everything now is about, you hear a lot about ecosystem, right? Everything is an ecosystem, everything is an end-to-end solution. From assessment planning through learning, coaching, prediction, patients need to take responsibility for their own health care. So through treatment management, diagnosis, all the way through to learning about your genome now. Now we need to learn about our genome. So it's going to require a lot of learning and development, and that's where the TALENTECH comes in place. A lot of other areas, genomics, transcriptomics, epigenomics, proteomics, phosphoproteomics, and metabolic. Don't try to say all those too fast. So it's about learning. It's about predictive analysis with the AI. So the AI is learning, and we hope to incorporate the genetic learning into it, and then even the genetic treatment. But combining, Western medicine, Eastern medicine, European therapies, Indian therapies into this. And we need to know with the AI which ones you can take, what is the drug interaction. So we're even looking at learning for Chinese medical doctors, and also the drug interaction using the AI. So if I'm taking Eastern medicine and Western medicine, which ones can I take together? Which ones can I take together? And that was stored in your EHR, electronic health record. It used to be EMR, electronic medical record. Now it's holistic, so it's EHR. Now let's go to the future real quick. I think I have like 2 minutes. We've got scanners now in Dubai, in the mall. So we believe that very soon you'll be able to go in, you'll be able to get scanned, you'll be able to get your genetic test, maybe even have a video consultation right in the mall or in the airport with your doctor. And monitored ongoing with wearable IoT devices. Some of you may remember the tricoder. We're getting closer and closer to this. This was the 1960s in Star Trek. So it's really we call the emerging future, because it's not the future. We're almost there. I believe we will have something like this very soon. And there's actually an X Prize for this device called the Tricoder X Prize. So if anyone wants to apply to try to create one of these, feel free. You can win the $1 million X Prize. We're also looking at CRISPR, gene editing. We're talking to companies here in Taiwan that do that, and globally. We'll eventually be able to do gene editing, genetic therapy, knock out genes, knock down genes, and repair and replace your genes. And then last slide, I'll end with this, the journey towards Life 3.0. It's a new book that's out, I just read, fascinating book. I highly recommend it. It's from an MIT professor. But we're going from AI integration we're almost to the seamless AI integration with the patient, where doctors would be wearing the AR glasses. They're able to now use the iPad. So we go from AR glasses, iPad, all the way up to the full room-size equipment, where we have doctors in New York can get in the IQ and they can confer with doctors in Taipei or somewhere else. And then to the predictive AI healthcare, where maybe your doctor would be wearing the lens, and they have these now, actually, but we've got a ways to go, where the doctor will be able to look at you. Maybe you have an implanted IoT device, and your doctor can look at you and see your genome, see your healthcare condition, just by looking at you. And then at some point, we're all going to be connected. They've been doing this for many, many years. This is what you hear Elon Musk and Tesla talking about, which is neural lace. And they've been doing this many, many years. If you know someone that has the cochlear implant for hearing, they did it many decades ago. So we're definitely going to have this, and I will end there, and I've got to run out, but please look for us. We're going to have an event in October at the Taipei III, DigiBlock, DigiSpace. October, our IDC opens October 18th, and then I think October 27th, 28th. But you can look on Facebook, LinkedIn, Twitter, pretty much any social media. I've been on all of them for about 20 years. So look for USBCT, and hope to see everyone there. Okay, thank you very much. Thanks for your time. I appreciate it.
谢谢 David，谢谢讲师我们带来的精彩分享。